meeting. We've got lots of great content to share today. Happy Interprofessional Healthcare Month, because our theme for our panel today are healthcare professionals within our community. We are going to go ahead and get started and kick things off by just sharing our mission statement here. If you've never been to a Safety Net Alliance meeting today, welcome. We'll do some introductions in a moment, but our mission statement on the slide above helps share what we're all about. So we are here to unite, strengthen, and amplify the collective impact of diverse organizations and individuals dedicated to changing the lives of Northern Kentuckians facing adversity. And that's okay. But we're here because we want to be stronger, more compassionate, inclusive, and have equitable access to services within our community for all of our neighbors who might be out there struggling to make ends meet. Our vision, on the next slide, is that we're building a resilient community. We're here to envision a future where every member of our community enjoys equitable access to services, support, and opportunities as a springboard to a brighter future. So I don't want to read all the words up there, but we're out here right now because we believe that our community is the best possible, and we want everyone to have that same access to the best possible life that they can live. So thank you for all being part of this. All right, so as we get started, before we get started, we want to just take a moment and welcome any first-time attendees to a Safety Net Alliance meeting. And so if you're here for the first time ever, we'd love to get to know you. And I'm sure that there are other people in this audience who would love to get to know you and know more about the work that you're doing. And so don't be shy, raise your hand if it's your first time, and introduce yourselves.
Hello, my name is Deanna Shaw. I am the president of Nurture Minds Training Center. So we are a healthcare vocational school. We are based in Cincinnati, Ohio, so we are new to Kentucky. We just opened up a campus in Florence. We provide healthcare trainings for individuals as young as 17 into adulthood. So we have the state registered nurse aid program, and we also have the certified medication aid program. So in Ohio, we are partnered with different communities that help fund people's education, like Community Link, Ohio Jobs, things like that. So we are trying to build that community in Kentucky as well, to knock down any financial barriers that students might have so that they can elevate themselves and get education opportunities too. So I'm excited. It seems like this was the perfect time with the meeting agenda and things like that. So we just are welcome to Kentucky and hope to network here.
Thank you. Welcome. We'll kind of have a method to the madness. Anybody else at this table new who would like to introduce themselves? Okay, our next table back here. Any new people?
Hello everyone, my name is Brandy Rowley and I'm a stable families coach with the Brighton Center. Nice to meet everyone.
Hello, my name is Master Clevin from Brighton Center. I'm a legal system connector.
Hello, my name is Carla Wilson. I'm a financial wellness coach at the Brighton Center.
Welcome. Anyone at this table? Oh, you're all veterans, huh? Okay, I skipped over this table. We'll get to introduce you guys later. This table?
Hello, my name is Karen Marshall. I'm the Volunteer Involvement Program Support and Outreach Specialist for people working cooperative. A lot of titles. We have been to the meetings before, but this is my first. I just started in March. So I am now the new person in outreach dependency, and we provide home repairs and services within Cincinnati as well as in Kentucky for low-income seniors, mobile disabilities. So there's a need of grants, there's a need of home modification. We are an organization that is income-based, so but they can definitely qualify.
Good afternoon. My name is Lenora from here together with Beacon Health Addiction Treatment in Burlington and also in Richmond, Kentucky. And we offer residential treatment, medicated assisted treatment, intensive outpatient PHP to individuals suffering with substance use disorder. So if that's something you're interested in, I'm here to network and would love to be able to tell you more and see how we can serve this community together.
I am the opioid overdose education health harm reduction coordinator. Long title, that's actually not right. I'm nervous, sorry. I apologize. But I'll be out in the community eventually doing better training for overdose education than what I'm doing for myself right now. Have a good day.
I work for Blue Care Centers at St. Elizabeth. We have centers in Covington, Fort Thomas, Dearborn, and Grant. And you probably don't know this, but wound patients are 20 times more likely to bounce back to the ER. So we want to try to treat and heal them before they get to that point. So if you ever have anybody with wounds, please send them our way.
Hi, I'm Ashley Gassman. I'm the coordinator at St. Elizabeth Physicians Weight Management, and I am part of the community convener.
Good afternoon, everybody. My name is Ricardo Horn. I'm with St. Elizabeth Healthcare, and I'm one of the chairs of the St. Elizabeth Community Convener Group. Happy to be here.
Hi everyone, I'm Natalie. I work for St. Elizabeth in the Hospice and Palliative Care Program. The main reason for joining was we host events in the community to get folks living wills completed. So that's why I'm here. I'm also part of the community convening group focused on food security.
Hi everyone, my name is Ron Michelson. I'm a Veterans Justice Outreach Specialist with the Cincinnati VA Medical Center. As the name of our program suggests, we reach out to veterans who are involved in our local criminal justice system. We work with police, we do direct outreach into our jails, our local jails where veterans are identified, as well as our court systems to get them connected to medical benefits that they're eligible for. And then some. So if anybody is interested in working more intentionally with veterans you're coming into contact with, I'm happy to speak with you.
My name is Stephanie Trainer, and I'm with the Church of Jesus Christ of Latter-day Saints, and I serve as part of the Communication and Community Outreach Program.
Hi, my name is Kelsey Jackson. I am the Connect Resources Specialist at United Way Greater Cincinnati. I also work on the 211 line. We're a 24/7, 365 days a year helpline to connect people with the resources that you all provide. If anybody is interested in learning more about Connect Resources and how we can get residents directed specifically to the services that you offer, please find me afterwards, and I'd love to talk about it.
Do we get everyone? Oh, wait, there's a couple in the back.
Hi everyone, I'm Natalie Pasquanza. I'm sorry, I don't like me. I'm the Vice President of External Relations for Volunteers of the American United States. I am here because we will be opening the Freedom House program here in Northern Kentucky at the invitation of some other community partners, the Elizabeth Learning Center specifically. Freedom House is the only program in Kentucky that allows any and all children to come with their mom when they are overcoming substance use disorder. We call it a family-focused recovery program. Some other programs may limit numbers or the ages of children, but we've chosen not to do that. I hope to come back with more announcements as dates and things open up and when we will be opening, but I'd love to meet some people who either feel they could be integrated into that program or feel that they are part of that continuum of care, so we can start building that. So when we open the doors, we are all working together to solve this problem together. Thank you.
My name is Brian, and I'm the program manager
Drowning Ferry and Rescue Mission, a Christ Center organization that's 7 days a week, 365. We provide meals, chapel service, overnight beds, and our new long-term program, which we titled the New Life Program, is a 12 to 15 month residential holistic program. It's at Christ Center. And I'm grateful to be here. Thank you.
I'm Tracy Jackson. I'm a peer recovery supporter at the Peer Recovery Community Center in Newport, Kentucky.
Hi, I'm Christina Vickers. I am the new Outreach Community Peer Support at the Peer. I need everybody's business card.
Great. Got everyone, I think. All right, well, welcome to everyone who is new to our Safety Net Alliance meeting. Thank you for taking the time to be here, and I hope you all get the chance to spend some time with each other and get to know each other. All right, so next on our agenda are committee reports. So for those of you who are new to this audience, we have various committees that we have pulled together, and if you are interested in being part of any one of these committees, there is a QR code associated with each one of them, with the exception of the executive committee. We'll talk a little bit more about that in a moment. You can scan that QR code and indicate an interest, and someone will reach out to you so that you can become part of those standing meetings. We always are looking for new members and energy and ideas, so if any of those committees look interesting to you and sound interesting to you as we do these updates, please feel free to sign up. So we'll start with the executive committee, and Aaron, you can take that one.
Thanks, even though I missed our meeting yesterday. The executive committee is responsible for overall vision of the organization and management of the organization. It's all volunteers elected from this body. So what we've been working on lately, we mentioned in weeks past that we were starting a pilot with the United Way's Care Suite that's coming out. We have 6 organizations that are on that, and we're pretty close to going live with it. We have some adjustments and modifications happening to it. We've started extremely simple, but to remind everybody, if you're not familiar with what it is a client management system that is funded by the United Way for smaller agencies who don't have a CMS. They can actually use it as their CMS, so it can be beneficial that way. But what it does is allows us to send referrals to other partner agencies. But here's how it's better than what we've had in the past. 2 reasons it's better. One, it puts the impetus on the partner agency to be reaching out to that person. Well, I'm going to tell you 3 reasons why it's better. 1, it puts the impetus on the partner agency to be reaching out to that person. So eventually all SNA members will be able to join. You'll have to have an agreement with us that says you will do certain things in certain time frames when you receive referrals. So rather than giving the client a list of people they need to go and call, now you're connecting them directly and taking some of that burden off of them. I'm going to give you 4 reasons because I keep thinking of one. 2, you are able to share through a memorandum of understanding that your agency would sign. You're able to share demographic data, qualifying data, and documentation. So, when somebody comes into my office at Faith Community Pharmacy, I can collect all their information, and I can identify they need services from the Brighton Center. When I send that referral to the Brighton Center, they have all their qualifying information already there. So that person doesn't have to go and take the documents again and do everything else to get qualified, and Brighton Center will reach out to them. 3, we are building logic into the system, and so you will only see programs that they qualify for. So if the person doesn't qualify for a program, you won't be able to refer them to that program. Or if that program is out of money, you won't be able to refer them to that. So hopefully gone will be the days of where somebody needs rental assistance and you give them 5 phone numbers to go and call, or you sit with them at your desk and you call 5 phone numbers with them, just trying to find out who has money. And the last thing, although there's many more, the last thing I'll mention that makes it better is you'll be able to, all your people that you refer, you will be able to go online and see what's happening at all those other agencies. So you'll be able to see, have they been contacted? Were they able to be helped? If they were able to be helped, what services
that they can see. If they weren't able to be helped, why weren't they able to be helped? And so it takes a lot of burdens off clients. We believe that through creating this interconnectedness, we are going to accelerate the movement towards thriving, and we are going to improve the likelihood that someone is able to thrive, because we know transportation is a challenge, we know time is a challenge, we know making phone calls and getting turned away over and over again is a challenge, and we hope to eliminate those things so we can bring the continuum of care around the person and advance symptoms. So it's pretty exciting. We're grateful to United Way for the partnership, and I would hope that in a year, this will be open to every agency in the room. That's the goal. We want to have a few agencies on it, work out the kinks, build it up, and then we'll have it available for everybody else in the room. So we're very, very excited about this. We've also been working on bylaws, which I promise you'll get to vote on soon. We realized in the last set of bylaws we sent out, we had totally missed a section. So remember, we're all volunteers, and most of us run other organizations. So that's why, and then we're working on some big grants and hope that the State Dental Alliance can actually hire somebody whose primary job is going to be taking this care suite and helping us get it implemented across the community.
Thank you, Aaron. Lots of exciting things happening there. The next committee is service integration. Who would like to represent service integration?
I would like to represent that. I'm Lisa Anglin, and so I work with service integration, and Aaron has done a great job. I just read.
A little closer. Now it's off.
Closer?
Lisa, service integration. Thank you, Aaron. You've done a great job of really saying what service integration is doing with the plan to bring us all together. So right now what we're doing is with our intake, just kind of making that visually appealing, easy to move through so that everyone is on the same page and working well together. So that's what we have going on.
Sorry I stole your thunder.
Oh no, take the thunder, and I'm ready for member engagement. Is that coming from you?
Yes, member engagement. So I'm a member of that committee, but Laura is the chair, and I'm going to be talking a lot, so I'm going to let her tell you what's going on with member engagement.
Hello. So with member engagement, our job is to design these fun meetings, right? Have what we're going to be talking about, find the panel members, develop the questions, and make sure that you guys have a great experience. So that is the job of service integration. No, it's not. That's your service integration job. That's the job for member engagement. And we are always looking for more people, more friendly faces to come when you come in. And we're also working on the Safety Net 101. So if you're a new member and you come in, we'll have a packet for you that you can learn how to do alerts. You can learn how all of the great things that we are doing as a corporation, as a committee to do, make sure that you can utilize Safety Net in the best way possible. So those are some things that should be rolling out soon. Everything takes a little bit longer, as Aaron said. We all have jobs too. We're all volunteering to do this, so some of these things take a little bit longer than normal. But member engagement is a whole lot of fun. So if you're interested, it's on the back of your sheet is the QR code. So if you're interested in any of these committees, remember to scan that QR code and give us your information, and we will reach out to you.
And if you join, we get to sit in the VIP lounge, apparently. So, if you'd like a more comfy seat, join member engagement committee.
External relations. You're walking towards Kim too. You're both going to this corner here. I got in.
Sorry, you should have stayed here when you were over here. Kim Webb, one of the co-leads for external relations. The other one is Andy Brunsman. We too have been busy running our organizations. The world is on fire some days, so we do our very best. The committee will be reconvening when new doodle polls going out to find a more suitable time for new committee members. This is a great time to join our committee. We focus a lot on advocacy, staying abreast of what's happening, sharing that information. One of the big things is getting on the bus to go to Frankfurt with our city leaders. A whole litany of fun things, but we're the best committee to join. If you'd like to, I'm going to make the quick because I feel like we're all pulling our out. If you'd like to advocate for people people that we serve in our community. For whatever your passion is, you are the experts. We like those experts to come to the committee to share that so we can share it with the entire committee. Other thing, Facebook, we will officially have our Facebook up and running. That will allow us to go. There's going to be some tweaking that's occurring because it's not going to be a public post for people in the community to ask for things, but just more of a Q&A for our partner organizations to access. So again, join the committee. We're pretty fun. We'd like to have a good time. Andy, do you have anything to add? You have a loud enough voice. You don't need a mic.
No, I don't have anything to add other than just apologizing for the doodle poll that we need to get out to everybody. So that will come, but we are going hybrid, but we do have a permanent space now for our meetings. Beacon Search Bodybuilding, the light flows Wednesday on it. But outside of external relations for the whole safety net, if any of you guys need meeting space, if any of you guys want to run some programming out of the space in Covington, please reach out to us. We have a space roughly as big as half of this space now, and we are maybe looking to bring the safety net resource fair back as one of our external relations things that we haven't done since 2019. But we now have a space that my Beacon Cert team is trying to designate as a room in the inn for safety net partners, so that we can start to bring some safety net centered programming back, whether it's social workers to come talk to veterans, whether it's dietary people to come back to talk to diabetics, whether it's a blood drive. A lot of people have been asking us, can we mobilize as a safety net to do a blood drive for Oxford? I'd love to. We now have the space, but I'd love to do some safety net centered programming in conjunction with our external relations, because I think now with a small space is a time where we can do more, for more, with more, and get a little more innovative in how we work together as a multi-unit safety net service providers.
Thank you. See, lots of energy on that team. So,
if you need a place to have your fantasy football draft, if you have children getting married, whatever, baptism. I will mention one thing that's kind of external relations, but not really, but our hero, Jared Mueller, is working on big updates to our website that is going to make it much more beneficial. So he's doing awesome on that, and that'll be coming out soon.
Safety net alerts to Jared and his team and his partners, and also shout out to Brighton Center, who's going to take responsibility for the alerts.
Yes, they're my heroes.
If you noticed, we've had a little bit of delay with alerts. Jemiah is no longer involved with the safety net, so there's been a little bit of delay. Please don't give up on the safety net alerts. We're going to continue to use the same service, but Jared and his team have been working to update it along with the website, which we have a sneak peek and it looks phenomenal. So keep using the alerts. Again, as a reminder, this is not job posting, this is not fundraising. This is about extra resources you have, or you're in search of a resource for somebody. So, and then make sure you put an expiration date, or so that we can clean it all up. So it's just really great, some of the external things we do. Lastly, take care of you. The work is hard. We're in this together. It doesn't matter what sector you're in, if you're in housing or the lack thereof, food or the lack thereof, any of those things. We're all in this together. We're better and stronger when we all stand firm and within our community. One of the things I learned from Danielle Tour about our statewide advocacy group is that we are all charitable nonprofits. We are more than a mission. We're a business. We have volunteer opportunities, lots of other things. So that's part of our push too, as well, for our community.
Thank you, Kim. All right, community impact. Who's our speaker on behalf of that group?
Jenny's on vacation again, and she deserves it. So I am the one who is speaking on behalf of community impact again. And listen, I know you guys aren't all super excited about data, but it's more than just data. I am too. We're talking about celebration, people. So we're a fun community because we're going to be doing celebrations. So if you want to join in, there is a QR code that you can send something to Jenny, but we are meeting next Wednesday, the 28th, from 12 to 12:30 virtually. So if you want to see what's going on, let's get some stuff done.
We're going to have our first ever SNA Awards this year?
We're trying.
Okay, we're trying. That makes me happy.
Great. Thank you, everyone. If you're interested in the committee, please sign up. We want to get as many people involved as possible. All right, so now we're going to move on to our healthcare panel, and I'd like to call up each one of our guests to join us on stage. There's a mic up there. And as you go up there, I'll do a short introduction, but we'll really let our panelists tell them about the important work that they are doing. Okay, so this is our healthcare panel, and they are representing diverse areas. So I'm going to start with Fardisa Hassan, who is the founder of Layla Urgent Care, Dr. Rob Tracy, who is the faculty for the residents at St. Elizabeth and also heavily involved in the Esperanza Clinic, and then Dr. Holly Vanneman, who is the Associate Dean at the UK College of Medicine at NKU, and they have an awesome program called Compassionate Care Reaching You, CCRU, to get those medical students out into the community and serving. So let's start. Fardisa, you want to take the first question, just tell us, well, how did Layla Urgent Care get started?
Hi, everyone. Alright, hi everyone. My name is Fardisa Hassan. I'm a nurse practitioner, and I am the owner and the starter of Layla Urgent Care, a small urgent care located in Hebron. We've been open about 3 years now. Yay! As a small business, they say the hardest part is surviving the first 2 years, so I made it through that. What I do is, aside from patient care, I'm very involved in community engagement. I'm doing community health fair, free health screening with different agencies. My passion started way back when I was in high school. I love being able to help people, especially with language barriers. I am from Somali. We arrived in the United States when I was 13 and trying to maneuver around the language barrier, education, health literacy, which is the biggest thing. And I've been my mom a personal interpreter since I was 13. So it kind of goes hand in hand of why I'm passionate about community health. I do annually community health fair. The past one was back in February, and every year it just increases with community partners being part of it, as well as individuals coming and getting free health services. So on top of that, I'm a mom of 6 and I love being a mom. That's my number one job. Aside, and everything else is just a hobby.
Dr. Tracy.
Yeah. Hello? So my name is Dr. Rob Tracy. I'm a family physician. I practiced primary care in Campbell County for over 30 years. And about 4 years ago, I transitioned to St. Elizabeth residency program, and I'm the faculty there. I'm also going to put in a quick plug for Faith Community Pharmacy. I'm on their board, been associated with them for a number of years, and you'll see with Esperanza, which I'll talk about, many of our clients and patients there utilize Faith Community Pharmacy. Also, we have our golf outing on June 7th, and we are still looking for foursome. So if you know anybody that can help, please reach out. You can talk to Aaron, he'll get you set up.
There's the plug, man. Totally against the rules, but if you do it, it's fine.
Well, I didn't know. I'm new to this, so I'm so sorry.
No, if you do it, it's fine.
Alright, so my goal with Esperanza is 2 years ago, we charged our residents in finding a community-oriented primary care project to do. And one of the things that they wanted to do was reach out to the Latino community, in particular Esperanza, because they are folks that do not have access to health care. And we see a lot of those patients come into the hospital and we take care of them. Unfortunately, we take care of them after their conditions have been deteriorated, and we realize that many of these folks, had they gotten primary care services earlier, they probably wouldn't need to be in the hospital and they wouldn't have the consequences they're having. So working with Marlene Fagan and Marianne Barnes and a few others, we worked with Esperanza and we created a clinic in the back closet, and we started getting supplies, and we slowly started seeing patients there every week. And now it's gone on for 2 years, and consistently we see people every Monday afternoon. And the folks that we see are folks that are, they have no insurance and they have no ability to get insurance. And so we provide them free care, and we try to provide them good primary care from the standpoint of chronic disease management, in particular diabetes, hypertension, and a few other things that we see. And we are partnering with other folks to help us to continue and expand that care. I appreciate Aaron asking me to be here, because that's one of the things that you all can help with, as well as other services in the community.
Hello, my name is Holly Dam, and it's a pleasure to be with you today. I serve as the Associate Dean for University of Kentucky College of Medicine's Northern Kentucky campus. I'm a proud St. Elizabeth physician, have been a family medicine physician, similar to the amazing Dr. Tracy, for a shorter amount of time. I've been practicing for about 25 years. But I've been very honored to be able to represent my alma mater, UK College of Medicine, here in Northern Kentucky. And one of the most important aspects of medical education is to develop in our young physicians during their training a heart for the community and a heart for the underserved during those very formative years of their education. It's kind of like instituting, and the way I kind of liken this is, it'd be really hard for me at the age of 51 to all of a sudden decide that I wanted to learn how to ride a bike, or that I wanted to implement some sort of exercise into my daily routine. Those are things that are much easier to do if you grow up doing them at a young age. And so along that philosophy, we've incorporated that into the education of our training physicians. And so when our campus started here in 2019, so UK has been a trusted and very accomplished medical school in the state of Kentucky since the 1960s. But realizing that we had lots of room for increasing the healthcare force in Kentucky and in Northern Kentucky, that we needed more physicians, we started to create regional campuses around the state. The first regional campus was created in Moorhead, the second was in Bowling Green, Kentucky, and then our campus started here in 2019, and we accept 35 students per year. So in addition to training students, we also wanted to make certain that we were able to offer them local opportunities to be involved in the care of the underserved. We created a board of students long before we had the name crew, and we proposed this idea to them of community outreach. And they came together and threw a few names around and decided that they wanted their outreach to be called Compassionate Care Reaching You, CCRU. And so through CREW, we have been able to provide health care to the impoverished in the community. We've been able to participate in health fairs. We are able to participate in other events throughout the community where my students are not only providing a service to the community, but they're also learning in the process. So for me, it has been a win-win. So thank you to those who have supported my students as they go through this lovely educational endeavor of becoming physicians.
Awesome. Do you want to talk about the Large Christian Ministry and as well as emergency shelters?
Sure. Yeah, I can expand upon it. So I see Kim obviously sitting here in the crowd. My husband, Jim, was on the board at the emergency shelter of Northern Kentucky over 10 years ago. was actually one of the folks that brought the amazing Kim Webb on as the director of the emergency shelter of Northern Kentucky. When I was talking with my husband after joining the College of Medicine about my struggles to be able to find a free clinic opportunity for my students, he said, you need to call Kim. So I called Kim, and I had this big proposition ready for her, and I was ready to sell it, and it didn't take a whole lot to sell it. She said, pick me. Due to Kim's very generous partnership, she was able to establish my students' first opportunity to take care of the homeless at the emergency shelter of Northern Kentucky, where they see patients on Monday and Wednesday evenings from 6 to 9 p.m. Under the direction of a physician, myself, Dr. Tracy volunteers there. So these patients are getting good care and my students are learning, but it's also under the direction of a board-certified physician who are community physicians who have volunteered their services. We also have been able to expand our outreach to a clinic that we offer one Saturday a month at Florence Christian Church, where we take care of patients from 9 a.m. until about 1 p.m. on Saturday a month who are in need of care out in the Boone County area. And that is in addition to the many health fairs that they're also involved with and other things, and getting sort of the word out that they're here and they want to support the healthcare needs of our community.
Thank you. You guys, you're through this mic now? Okay, good. Awesome, thank you. So, our first official question to share with everyone, and Layla, producer, what is driving the need for the services that you are providing to the community?
So, is it working?
Yep.
Yeah. All right. So, what the drive? So my first is obviously the initiative of putting in the work. What drives me the most, I go back to literacy, language literacy, health literacy. Many of the people that I take care of and I serve are either they speak French, Somali, Arabic. I don't speak French, but I have a staff that does speak French, so we always try to educate the individual about their right as a living residents in Kentucky. Many people, especially people from my country, when you hear a hospital, we assume it's everything. And many people, especially newcomers, they go to the emergency room for headache, for something related to primary care. So the big thing that we do is educating the members that there is certain specialty, and it's not about just going to the hospital whenever you have a headache. So we talk about the resources that is available to them and how they navigate through that. So my drive is educating people literacy about health literacy.
Awesome, thank you. Dr. Tracy, what about the challenges at Esperanza?
Yeah, with Esperanza, I think our challenges are just making folks aware that we're there. And as I look out and I see everybody out here, I think that would be awesome to help drive those folks to Esperanza if they're in need of healthcare, especially if they lack insurance and can't get insurance, because those are the folks that we're primarily focusing on. If they do have Medicaid or Medicare or some kind of other service or insurance, we help direct them to the correct resources in the communities. I see a central theme, which is really how do we keep folks, how do we direct people to the right healthcare and spare the healthcare system, which is somewhat broken and going bankrupt, and how do we help get these people the right kind of care and not using the emergency room. And the other part I'll share with Dr. Hanneman is that we also want to create a culture with these young physicians, letting them know that this is part of their being and creating that service attitude early on. I do get to work with the students at Crew, and it's just so, I get kind of giddy sometimes because I forget just how new they are and like how little they know. And then I get to work with residents, and it's fun to watch them mature in the 3 years that they're there. The one thing that I hear over and over from all my residents that go to Esperanza is the patients they serve there are just so grateful. They love going, they're eager to go. I never have to worry about getting a volunteer if somebody is sick or on vacation, because they like going there because they see the gratitude that is expressed by these patients. And medical students are the same way. We're packed into this little 4x10 room, but as many students as they can want to be there. So I think that's great. I think that's one of the other things that we're trying to do.
I think from a challenge perspective, I think I would identify too. I think one of the biggest challenges which is more of a challenge is that the folks that we need to care for, we need to meet them where they are. We can't expect them to come to us. And so, how do I find them? How do they find me? How do they find my students? And so, being able to identify that particular hurdle, I think, is one of our biggest challenges. The other challenge is a more granular challenge, and that is that I need people to help me. The physicians that I rely on to support my students are busy clinicians. And my students can't do what they do without their oversight. And I sometimes struggle to find folks who have the time and the ability to provide that oversight. And so I rely on amazing people like Dr. Tracy and a lot of the other amazing physicians that train the residents and have a heart for academic medicine, but I don't want to spread them too thin. And so how do I get other physicians within the community to also develop this passion for underserved care? And how do I instill in them a passion for educating this next generation of physicians that are going to be caring for the people in our community when they no longer can be the physicians that are doing so? So those are two challenges that oftentimes keep my wheels turning right when I get ready to go to bed at night. Those are two big challenges, I think, in regard to fulfillment of our mission.
Okay, great. Thank you. Okay, so I kind of jumped around in those two questions, combined two questions into one. So the third question that we'll talk about now is how can we as local organizations collaborate more strategically to support some of the unmet needs that you're working so hard to try to address in each of your outreach?
So there's a lot of resources, and many times, many of anything is never too good. People hear different organizations, we do this, we do that, but when it comes to, again, I'll always go back to the language issue because that's the big thing that I deal with and I try to find to address that. So when somebody comes to an organization and they are giving the resource, following up is a big thing because I can pick up a paper here, but if I don't know what to do with it, or I am scared because no one might speak my language when I go there, so having the resource is great, but also following up with it. If an individual take your card or came in a resource, get a resource from you, follow up with them and saying, hey, were you able to get whatever service that you needed? That's the big thing. The amount of time that I call somebody and ask them, were you able to call, the big thing that I deal with is Connect, health insurance. And I give the individual paper and I say, okay, here's the income verification, here is who you need to call to make an appointment. For whatever reason, that doesn't happen. 3 days later or a week later, I will call and I say, hey, did you get that taken care of? So we can find a primary care, address your health issue, and they're like, well, I don't know how to go about it. Or I'm scared, what if I don't have somebody who speaks my language there? So me taking that initiative and following up with them, when I can kind of set up a time with them and be active in it and do that work for them and set up with the right people, so that way they don't fail and not get that care that they need. So, short answer is making sure you follow up. Whatever you provide, that you always follow up.
And we can appreciate that so much. As Aaron talked about, we're working on this Care Suite platform that can help us make referrals, and then we'll have some visibility into whether or not that referral is picked up and people are able to get services. And so in the meantime, though, you're right, it takes so much, it takes an extra step, right? It takes an extra effort to just make sure that folks are getting connected to the right resources. Look at all these resources out here. There are so many, and we all just want to do the right thing for the folks who are within our community. Dr. Tracy.
Yeah, I think one of the challenges we're seeing is, since we work with migrant immigrants, is especially in the current healthcare setting, a lot of folks are now afraid to access care or to access organizations. So I think making sure that folks feel comfortable and they understand, I think folks here, their mission and their values are there designed to care for individuals. And I agree. I think follow-up is really a hard issue. We've seen this with Faith Community Pharmacy. We've had to work so hard because we get people connected, and it's maybe 50% of the time they actually can get the meds they need. I know I'm just seeing people with healthcare issues, and our residents are, but that means they probably have multiple other issues that they're trying to deal with, just, get by day to day. And these are really hard-working individuals. So they really just need the resources in the community to help them to just have a decent quality of life that they should be able to get to.
I think I would say first is help us identify or help connect us with the folks that need us most. Along the lines of you can only help them if you know who they are and where they are and how you can take your services to them. The next would be assistance in helping me integrate my students into the community. Us being fairly new here, only being here since 2019, continued integration to the community, I think, will go a long way. And also will, if we are able to instill in them these values, I think that we're looking at a very bright future for our healthcare profession, with physicians that have a heart for the underserved patients of our community. And lastly, I want my students to stay in this region to practice. They don't have to. They're with me for 4 years, and they graduate with their MD, and then they go on for their residency specialty training. They can go anywhere they want for residency specialty training. I'd love for them to stay in this area. But when they're finished, I want them to feel so embedded in our Northern Kentucky community that there's nowhere else they want to practice than here. And we can do that by embracing them and supporting them and showing them all the wonderful things that our community has to offer. And so that's another way that we can assist my students in regard to developing their professional identity and wanting to be a part of a safety net alliance.
Wonderful, thank you. So I have another question that I didn't tell you I was going to ask. But, so we work in a really hard field, right? We hear lots of sad stories, and we know that there's a lot of need out there. But there are some victories that happen every day in each one of our organizations. So I was hopeful that each of you could take a minute and tell us a victory, a story that you experienced in the work that you're doing that just really fuels you to continue to be inspired to do this work. I know it's last year. Sorry, okay, take a minute.
So I kind of have so the big thing would motivate me to always keep going is my kids. I didn't start school until I was 13 years old when we moved here to the United States. So starting middle school at 13, not even knowing how to write my name or the ABC. So that was my number one motivation, and I always look back my struggles through middle school, high school, even college, just trying to write a semi-perfect paper. And then now that I'm a mother, I'm looking at my girls and making sure that that I show them I am just more than a mom. Showing them the road to success and starting early. And I'm from a culture where I always thought, what's the point of going to school? You can get married, have kids, and you got to take care of those kids. So what's the point of going to school and getting that education? And I always tell my daughters, it's your option. It's important to get education and continue to push yourself. Even if you don't use it, you are educated. There's something that you can rely on yourself, if you need to. But that's my motivation, keeping moving forward and educating young girls that you are just more than a girl that's going to grow up, get married, and have kids. Culture has changed. The narrative is different than 50 years ago. What my mom has experienced and how she was brought up is not how I want to raise my daughter. So that's my motivation in a long way.
I was thinking of a particular story of a patient that we saw at Esperanza. He was a young man, I think he was 20 years old, came in, crutches, limping, and had an injury back in Guatemala. And we went through and we were evaluating and worked him up. We got x-rays and managed to get an MRI. And he had kind of totally blown out his knee. And what I really loved was our biggest challenge right now is creating a network with specialists that we can get patients to the right specialists to get the care that we can't give in primary care. And the resident reached out on her own, talked to the orthopedic surgeon. The orthopedic surgeon graciously and excitedly took the patient on, offered to provide the service at no charge. We actually worked out a payment schedule through the surgery center, through Esperanza to get his surgery done. So it was understood this just not all just free care. You're going to have to earn and work on this. But this guy did get his surgery. He's now gone from being quote crippled at age 20 to back to working and a productive person in society. And I love that we were able to reach out. The resident took the initiative to really do this, make all the calls, the connections, and then the specialists were willing to help and do that. We had another very similar story with a guy with a parathyroid tumor that was cancerous that got removed, that one of the ENT guys did. So those are the kind of things that have dramatic impact on people's quality of life that we can do. We need to continue.
Beautiful. Relationships mean so much, don't they? Love those stories. Makes me proud. I guess one of the stories that comes to mind was when I was working at one of the Florence Christian Church clinics. I was working with one of my M2s, Evan, who had seen a patient and had come in to check out to me. And in the process of checking out, I could tell that something was really bothering him. And I said, Evan, what's the matter? It seems like you're having difficulty with your words. And he said, Dr. D, I'm sorry, but I'm just so bothered. This young woman slept in a tent in the woods last night, and I just can't get it out of my mind. Just give me a minute to collect myself. And I thought, how profound was it for him to have to collect his thoughts before he presented that patient to me, because he was so moved by the honor and privilege to care for this woman, and also so concerned about what she was up against. It instilled in me and sort of confirmed in me the reason why we're doing this. It goes beyond just teaching them medicine. The other thing that I thought was kind of interesting was my daughter lives in Covington, and I had gone to visit her, and we were walking down the street, and there was a fella sitting on the side of the street as we were walking with my daughter, and he said, "Hey, Doc." And I looked over and I said, "Hey, buddy, how are you?" He said, "I'm good, it's good to see you." And my daughter didn't have my scrubs on, I was just in regular clothes. And my daughter said, "How do you know him, Mom?" And I said, "Oh, I've cared for him at the emergency shelter." And he had remembered. And he said, "Hey, Doc." And it just made me happy to know that he remembered me and felt comfortable to say hi to me. And that my daughter was able to see me in that moment, just someone who was making a difference in the community. So those are just two stories that come to mind. It's awesome. Thank you.
All right, we have about 4 minutes left in this part of our agenda. Do we have any questions for our panelists that you'd like to ask? Yes.
Specifically, how does Esperanza Center address mental health issues with patients?
We try to manage it ourselves with medication if we can, and if we need to try to do referrals, we will send them, maybe to North Key, if possible. We do have a clinical social worker in our office at the Center for Family Medicine, so sometimes we have brought people there.
Any other questions? Yes.
I was just curious at Esperanza if you guys are able to provide vaccinations to those without insurance.
No, that's one of our goals. Hopefully, moving forward, we would love to be able to provide what I call like weekend wellness clinics, where we've done this before through St. A's, where you can have vaccines, mammograms. We do get a lot of the women signed up for, it's called Seek, Test, Treat, and where they get free pap smears and the results right away. But we are lacking in some of the preventative healthcare things that we need to do.
I just want to jump in. The question about the vaccinations, nurse advocacy center for the underserved. I've done how that Love you all.
So I'm with KU's Nurse Advocacy Center, and we are working with a grant right now to provide adult vaccines to uninsured patients, which we're kind of having a time finding. I would love to work with you.
Okay, I think that would be great. We do see some children, but we see mostly adults, and there would be plenty that would be, because diabetes, and that's a chronic condition, and most of those should at least have a pneumococcal vaccine, if not other things.
I want to add one more thing. So at Layla Urgent Care, we are contracted or the free vaccine services to the state, where we vaccinate children and adults, uninsured, or have Medicare, Medicaid, and especially if they don't have insurance, it's free of charge. I think similar to the program that you're speaking of. We also do, especially with children, their wellness visit to go back to school. We don't charge for the vaccine, but we charge like $45 to do a wellness visit. So that's a service that we have at Layla Urgent Care.
Is volunteering at Esperanza strictly for like medical students, or can anybody participate?
Sorry?
Is volunteering, is that strictly for the medical students?
The residents are the ones that are seeing the patients. They do have some volunteers that are, because all our patients are Spanish speaking, so we have to have interpreters. So if you have skill, that would be what we would need.
Question for Esperanza. So years ago, when you would have health fairs, there would be lots of different resources there, and I'm with one of the Medicaid providers, and I used to set up there, but I've lost contact kind of since you left. So how do you get back connected again?
I think I would contact the director. I believe it's Leo. I don't know. Do you know Aaron?
just hired somebody and
It's by
I think-
11. It's by 11.
Yeah, I said somebody new, I think. But I think I would reach out, and if you needed to get a contact through St. E's, Dave Johnson with the ministries, he would probably be a good connection as well. Or you can reach out to me, send me an email, and I can help.
I can help too.
Okay, perfect.
One last question here in the back.
I just want to know if at any of the services, do they require any appointments or is it all walking?
And Esperanza, we schedule patients so we know who's coming, and we have a waiting list. You know, we're backed up. We need more appointments. That's one of our goals, is to try to have more time.
For our office, unless it's a primary care and that individual has a chronic illness that we need to manage, otherwise it's walk-in, whether it's a vaccine or a wellness visit, always walk-in.
For the emergency shelter in Kentucky, it is for our guests only, so for our clinic and stuff like that, so if you're an overnight guest, you can see the clinic when you're there. Shower and laundry has access to the clinic, so we are not by appointment, it is for the guests in the facility. So I just wanted to clarify that.
Okay, so everybody heard that, for the emergency shelter, if you're a guest of the shelter, you can have access to the medical services that are there.
And then for Florence Christian Church, when we're there on Saturdays, we don't require appointments. And it seems like it's feast or famine. Just this past Saturday, we only saw 3 patients, and we could have seen many more. And so getting the word out in regard to our presence there would also be a huge help for us as well. We could see upwards of 10 to 12 patients in the time that we're there, and we have not been seeing that volume.
All right, so we can have a round of applause. Thank you. I think I've lost power on this mic. If you guys could take a seat.
Thank you so much for being here and sharing the really awesome work that you are all doing. All right. Whoa. Okay. So as we start to close out today, we are now going to allow some time for announcements. Please keep this program focused, no fundraising or job postings right now as we go through these announcements. And resource sharing is another really valuable announcement. You can also submit a safety net alert to make a similar announcement if you don't want to stand up in front of everyone right now. But we'd love to hear what's going on within your organizations. Any announcements that you'd like to share?
I'll start. So I can't remember if I sent out an alert, but if I did not, and even if I did, you'll be getting another one. But Wellcare is doing their Community Health Champions Awards, and we're taking nominations. So in this room, there are so many people that go above and beyond in what you're doing every day to serve the community. And I would really encourage you to nominate someone who is a community health champion, who's a health champion. And the winning, so there's a winner in each region of the 8 Medicaid regions, and the winner organization gets $3,000. The overall state winner gets $5,000. Teresa's husband from Fiesta, he won last year. He was nominated, won last year. We've had people from Ethan's Purpose, from Chelsea Ryan's Festival of Hope win. We've had Welcome House win. So just really anybody that is out there, please nominate. We have so many people doing such good work in the community.
Thank you.
Thanks. My name's spelled A-A-R.
Yes, Douglas Greer with the Brighton Center through the Kentucky Career Center. Just wanted to let you know on your table, probably have one of these that talks about our job fair. It's going to take place tomorrow. King County Public Library at the Erlanger branch. We have roughly 38 employers right now with some resources that will be available also. I do need to make this disclaimer about it. I share this information so that you will provide it to your customers and your clients. One of the things that the employers have communicated with us about in some of these job fairs, a lot of times they'll get representatives from organizations, excuse me, and they're actually looking to fill their workforce, so they really want during that time from 11 to 1 to connect with, potential candidates. If you are trying to reach an employer, we're happy to help you do that at the Kentucky Career Center. We'll get you connected. If you want to have services brought to your location, we can do that as well. But during that job fair time, we just ask that you allow that to be the opportunity for employers to speak directly with your customers who you employ.
Hi, Mary Kay. I'm louder than I thought. It's my teacher voice. I'm Mary Kay with Rebate Covington. I just wanted to mention a couple things going on this summer. I know you take care of core needs, but we also know the children's core needs are vital from birth to 5 during the early brain development and caring. We do a lot of experiences and resources that support children and families. Not just in Covington, kind of goes beyond that. So we have a couple things, the Early Childhood Fun Fest. This is where we intentionally work with partners. Each partner chooses activities from the earliest childhood standards. And in a sense, we're modeling and inviting families in to participate in that, and then giving them resources so that they can continue that at home. So it's a really fun event, it's totally free. So that's one thing, June 20th. In Covington. The other is that we also have experiences where we do play groups, and Friday we're working with Big Hunt starting in June, and we will have coffee and conversation for parents, and the children have arts and storytelling for 4 to 6 year old children and their grown-ups. Those things aren't, it's not food on the table, but it's the food for the brain. And it's just as important, and it's vital time, so those are the resources. If you ever have any ideas or any ways that we can partner with you, or that we can support what you're doing, please let us know.
Thanks, Mary Kay.
Hi, I'm Kim Harrison with Roots of Love, Furniture Ministry in Northern Kentucky. I just have a huge shout out for Karen. It's from this meeting that I made an announcement. We were looking for volunteers, and she had a fraternity at NKU reach out to her looking for opportunities, and she sent them our way. And in these past, I think it's been 3 months now, it's been a blessing on so many ways. It lightens our load. However, we're pouring into them, and they're pouring into us, and we're being able to speak to them about it's so much more than furniture. They're transforming lives. So thank you so much.
You're welcome.
I'm Tracy at the Pier. We have a couple events coming up this month or next month. The Harm Reduction Family Education event is June 12th from 5 to 7. We're going to be giving out harm reduction supplies, and we teamed up with Life Learning Center. It's going to be at their location in Covington. We also have a youth and young adult video game night on June 13th. And then we have a Healthy Boundaries group starting on June 23rd. And all of it's free.
Awesome.
And I said one more thing. In July, the Safety Net Alliance is going to be veteran focused. So if you work with veterans and you would be interested in sitting on the panel, please reach out to myself or Aaron or Laura or Karen or Mary.
I have one announcement for St. Vincent de Paul. So beginning June 2nd, we start our Summer Breeze Heat Relief Program. And so if you're working with someone who is in need of an air conditioner because they're suffering from a chronic illness, kind of have to get a prescription from a doctor, but then send that into St. Vincent de Paul, and we're providing free air conditioners while supplies last. And then anybody that needs a fan who is in need of heat relief can come and pick up a fan as well. Just call our helpline and we'll arrange a time for you to come and pick that up. But that starts June 2nd, and St. Elizabeth helps us sponsor that program.
Jess, what was the address to get the fan?
Okay, well, call our helpline, 859-341-3219. And then that reserves a van for them to come in and pick it up. We don't want someone to make a trip if we happen to be out of stock. So. Great. I think that wraps up our announcements. Thank you, everyone. And is that what's next? All right, so last topic. Does anyone have any challenges, trends, advocacy that we need to have our eyes open and ears open for?
I'll just say, this federal budget that's going through could be devastating to healthcare, as well as a number of other things. So if you're of the mind to reach out to your congressman or senator and beg them from your constituency standpoint to please keep in mind those that are lowest income. This could be we could have 8.6 million people lose Medicaid that don't have anywhere else to go for it. And if you're like, I don't care about poor people, which would be weird that you're here, but if that's how you feel about it, just know that if 8.6 million people lose Medicaid, we're going to pay for it because they're not going to not get health care. They're going to get it in the most expensive fashion they can possibly get it. And that means all of our insurance rates are going to go up, and we're going to put hospital systems at huge risk to be able to provide continuing, ongoing, great care. So if you are ever going to reach out, now, I don't know if it will do any good, but now's a good time to do it.
Thank you. Anything else? Okay, I think that wraps up our meeting today. Our next meeting is June 18th. We will be doing immigrant services in June. And I just want to thank all of you for the wonderful work that you're doing out there. We appreciate your partnership and just doing great work every day. Thank you.